Good evening and welcome. I am Teresa Dews, President of Cleveland Clinic Euclid Hospital. I'm really pleased you chose to join us tonight for our event entitled Taking Care of Your Mental Health. Just some housekeeping information. This meeting is being recorded and will be available for on-demand viewing within a few days. The session will open up for a Q&A period at the end of our panelists' presentations. If you have questions, please type them in the Q&A box to be read and answered live. We will answer as many questions as time allows. I will serve as your moderator for tonight's programs, and our guest panelists tonight include Dr. Gabriela Stamper, Cleveland Clinic psychiatrist at Stephanie Tubbs Jones Family Health Center, Dr. Martina Moore of Moore Counseling and Mediation Services, she's the CEO, and Rick Oliver, LSW from Frontline Service. Welcome and thank you all for agreeing to participate in this discussion today. Mental health includes our emotional, psychological, and social well-being. It helps us determine how to handle stress, relate to others, and make life choices. Mental health is important in every stage of life, from childhood through adolescence, as well as adulthood. Our panel of medical experts are here for a discussion tonight, and they will cover different aspects of mental health. You will learn how to recognize signs of mental health issues, hear about techniques to help manage the daily stresses in life, and how to access mental health community resources that are available and when you need to seek medical care. This program provides an opportunity for discussion and questions to our panel of experts. So with that being said, I would like to turn it over to our first speaker, who is Dr. Gabriela Stamper.
Thank you so much. And hi, everyone. Thank you for having me. I'm Dr. Gabriela Stamper. I'm a psychiatrist, as was mentioned, with the Cleveland Clinic. I see patients both virtually through main campus and virtually and in person at Stephanie Tubbs Jones in East Cleveland. Today, I will be talking a little bit about anxiety, depression, and trauma. My goal is to help you understand what could be signs of these mental health problems and when to get help. First, I want to talk about anxiety. Anxiety disorders are the most common mental illnesses in the United States, affecting about 18% of the population every year. You might notice anxiety only in specific situations, like public speaking or on flights. It can also be more generalized and seem like the worrying just kind of occurs at baseline. I've had patients tell me that their anxiety seems to come out of nowhere and they have panic attacks. They feel hot and sweaty, they can't breathe, their heart is pounding and they feel like they're dying. Sometimes it can be, bad enough that they aren't leaving the house anymore for fear that they will have another panic attack like the one that they just had and they can't control it. Other times, the anxiety is just the voice in the back of their head telling them that you have to think everything through, every single detail, otherwise something bad could happen. It's normal to worry about things from time to time, but if you find that you are worrying all the time, that's not normal. Next slide. So anxiety can feel like a lot of different things. It can feel like having a sense of impending danger or panic. Something bad is going to happen. You can notice that you have difficulty controlling that worry. You might notice that you can't concentrate or think the way that you want to. Other times people talk about they have trouble sleeping. Either they're sleeping too much or they're sleeping too little, more likely sleeping too little. Sometimes people will talk about wanting to avoid things that trigger their anxiety. Not going out to places that remind them of when they've been anxious before. And sometimes people will have physical symptoms. They might notice that when they're feeling anxious, their heart starts racing, they can't breathe, they're sweating, they feel numb in their mouths or in their fingers. Stomach aches, also very common. So that's a little bit about anxiety. Now I want to bring in depression into the conversation. It's not uncommon for someone with an anxiety disorder to also suffer from depression, or vice versa. Nearly 1/2 of those diagnosed with depression are also diagnosed with an anxiety disorder. And depression isn't just crying all the time. It can look different depending on the individual. I've had plenty of patients tell me that they do cry, but I've also had several patients tell me that they feel angry all the time, or that they feel numb. Next slide. So with depression, you might notice different things. You might feel sad, empty. You might feel hopeless. Like I said, sometimes people feel angry. They feel really irritable. They feel frustrated all the time. Sometimes people feel like they're just not as interested in the normal activities that they used to enjoy. They stop doing their hobbies. They're not interested in sports anymore. They're not having sex anymore. Sometimes people will talk about just feeling low energy, just feeling blah all the time. Similar to anxiety, sometimes people will sleep too little, or other times they'll sleep too much. They might also feel like they're eating too little or too much. You might also notice that people with depression just kind of move or think slowly, just feeling like they're dragging. Other times they'll say the opposite. I feel like I'm restless and agitated. I gotta move, I gotta move, I gotta move. People will often talk about feeling worthless or feeling excessively guilty, ruminating about things that have happened in the past, feeling like they're letting everybody down, feeling like they're letting themselves down. They also might mention trouble concentrating or remembering things. My mind just isn't working the way that it used to. I can't remember anything anymore. I can't focus when I need to or when I want to. Sometimes people will feel like they have unexplained aches and pains, stomach aches that come out of nowhere, just general body aches that never seem to go away. And one thing that I really want to make sure that we bring up is thoughts about death or suicide. If you are having thoughts about death or suicide, that could be a very strong sign of depression, and you should get help. The last piece that I want to talk about right now is trauma. So in addition to anxiety and depression, I really want to mention trauma and PTSD. I think it's especially important for people to recognize that if you've had something really bad happen in your life, say something life-threatening. For example, you don't feel like your normal self anymore after experiencing that life-threatening event or seeing somebody experience something life-threatening. This could be a reaction to trauma. I've had patients tell me that they've experienced or witnessed incredibly bad things, like abuse. They've lived through serious illness. They have watched people get hurt or even killed. And that experience changed the way they go through life. But they thought that, since they weren't in the military, it couldn't be PTSD. This isn't true. PTSD and other trauma disorders can happen to anyone. Next. So when people have reactions to trauma, this might include things like intrusive memories. People might have flashbacks. They might feel like that traumatic event, that really bad experience is happening all over again. They can have nightmares. They might just feel really distressed, feel like I've got to get out of here if they're in a situation that reminds them of the traumatic event that they've been through. People might experience avoidance, just staying away from places, activities, and people that remind them of that really stressful experience. They just might not talk about it, not think about it, just kind of try to block it off. Additionally, they'll often experience negative changes in their thinking and mood. They might feel really bad about themselves, to the point where they're feeling like I've messed up. I am failing everyone. If I had done something different, this wouldn't have happened. They might have noticed that they're having more negative thoughts about other people or even the world. Other people are dangerous. The world is not a safe place anymore. They also might feel detached, just like they don't really belong anymore. And finally, they might also have changes in their physical and emotional reactions. You might notice that they're feeling easily startled, they're jumpy, always on guard. And they might also do things that are kind of self-destructive, doing things that are pretty dangerous, things that they wouldn't have done before. And I want to come back to this about events that could lead to PTSD. Lots of different things could lead to PTSD. It doesn't only happen in soldiers. People can develop PTSD due to many traumatic situations. Combat exposure, yes, but childhood physical violence, sexual violence, physical assault, being threatened with a weapon, being in a life-threatening accident, and there are lots of other situations that cause it. You can even get PTSD from witnessing traumatic events happen to someone else. So those were some of the warning signs about common mental illnesses, but it's also important to know when to get help. I'll just say in general, if you notice that the way you think, feel, and act is interfering with your life, if you are noticing that you are getting into trouble with those things, you should definitely try to get help. And I think it is especially important to ask for help if you are having thoughts about killing yourself. One of the easiest places to start getting treatment for mental illnesses is from your primary care doctor. Talk to your doctor and let them know what is going on. You can also make an appointment with a mental health specialist, like a psychiatrist or a psychologist, a therapist, counselor, anything like that, anyone who would talk to you. And if you're having thoughts about killing yourself and you need someone to talk to, contacting a crisis line like Frontline can be incredibly helpful. And finally, if you need help right away for suicidal thoughts, please go to the emergency room. All right. And here's where you can call to get an appointment with behavioral health at Cleveland Clinic. Go ahead and give that number a call if you need help, or you can use that link. All right, thank you.
Thank you so much, Dr. Stamper. Next, we have Dr. Moore.
Thank you, Dr. Dews, and thank you, Dr. Stamper. That was a great segue into what I'm going to be talking about. I'm Dr. Martina Moore. I am a licensed professional clinical counselor and a counselor educator supervisor. I am the president and CEO of Moore Counseling and Mediation Services, and I am actually on faculty also at John Carroll University in their clinical mental health counseling program. So I'm going to talk to you today, next slide, just a little bit about burnout and resilience, which is really a great segue into what Dr. Stamper was just speaking about. So let's talk about what burnout is. So burnout is that exhaustion of physical or emotional strength or motivation, usually as a result of just being prolonged stress or frustration. So a period of time that you've been exposed to high levels of stress and frustration could really lead to burnout. Many of us work long hours. We keep going quite a bit. Within the last couple of years, because of the pandemic, we had to work in different ways. We found ourselves working more online and doing more, which there was a direct correlation to this exhaustion. I had people telling me they had Zoom exhaustion and Zoom fatigue, which really led to a lot of burnout. And then what is resilience? So resilience is the ability to become stronger, healthy, and to be successful again after something traumatic has happened to us or something bad has happened to us. And it's our way that I'm going to talk about in a minute, as it says, bouncing back. Next slide. So burnout is a special type of work-related stress, and we do find it directly correlated to work. It's a state of physical or emotional exhaustion that is also involves a sense of reduced accomplishment or loss of personal identity. So you may find that there are things that you once enjoyed about the work that you do. You once had just all of this eagerness about it. And then over time you find, wow, that doesn't feel as enjoying, or you begin to dread it, or it begins to feel overwhelming for you. Even the thought about doing some of the work. So it's not a medical diagnosis, but some experts think that other conditions such as depression are behind burnout. And we do see that there is a correlation with people who are experiencing burnout also having some symptoms of depression. And researchers point out that individual factors such as personality traits, family life influence can also experience someone's burnout. And other things that I find is when people don't have support, or they don't have other ways to manage some of the stress, we'll see higher levels of burnout. Whatever the cause, job burnout can affect your physical and mental health. And you can find that the correlation happens between the both, that not only do you feel physically drained, but mentally you begin to feel drained as well. Next slide. So these are just some of the symptoms of having burnout. Having trouble getting started with your day. Maybe in the past you may have jumped up and just ready to get going, and maybe you're just having an extra cup of coffee. It's like, oh, I'm going to take a little bit longer now. Or becoming irritable or impatient with coworkers or customers or clients or patients. And you get to the point where it's just, okay, the things that you used to tolerate more are intolerable. Experiencing lack of energy to be consistently productive. It's like where you had the energy, it's just not there like it used to be. And your concentration may be off. So you find yourself maybe forgetting things. I have a lot of clients say that they forgot words, or they forgot something on their calendar, or they forgot what day it was and what they had to do. And just maybe even people's names and simple things that they would begin to forget. Next slide. So just a few other symptoms is experiencing lack of satisfaction from your achievements. You may still be doing the work, you may still be achieving things, but there's just not this level of satisfaction internally for you. Or feeling disillusioned about your job when you're now looking at it in a different way. And then what we can see is that we may do things like food and drugs or alcohol to try to make us feel better. Or we don't even realize that that's our go-to as a result. We may also see a change in our sleeping habits, like Dr. Stamper talked about. We may not be getting enough sleep, or we may be sleeping a lot more. And then another piece that we see is unexplained headaches or other physical complaints like back pains and stomach cramps. And so when I'm working with my clients, I'm really in tune to what's going on with their body and how their body may be reacting to these levels of burnout. Next slide. So ignored or unaddressed burnout can have significant consequences. Excessive stress, fatigue, like I talked about, insomnia, sadness or irritability, which really could lead into depression. The alcohol or substance misuse, it can even lead to things like heart disease, high blood pressure, type 2 diabetes, and we can become very vulnerable to other illnesses, like catching colds or catching other disorders that we could be more vulnerable to because our immune system is just not at the place where it needs to be. Next slide. So it can also affect your job performance and limit your ability to provide the best service to your patients, your clients, your coworkers. And people may start to feel like you're not a team player, or you're not pulling things like you need to. And you may even see that people are questioning you because they may see that, first of all, your affect, as we call it, your facial expression may not be the same, or just your energy level, or your buy-in, or just your ability to take on additional tasks. The energy is just not there. And it can begin to really affect your performance, being late, being tardy, taking longer to get some of the work done that you've gotten done in the past on time. It may just take longer for you to get it. And so it begins to affect your performance. Next slide. So let's talk about how to reduce burnout and build resilience. So researchers have reported that positive motivational interventions are the key to reducing burnout and building resilience in professionals under extreme traumatic circumstances as well. And so what we mean by that is that if you can internally motivate yourself, and we're going to talk about some steps you can take, but internally begin to motivate yourself, those are ways that you can really reduce your burnout. And I'm going to talk about some of those steps in just a moment. Next slide. So I talked about resilience, which is the ability to bounce back after an obstacle or a challenge or an adversity. It's the ability to get up after something has happened. And all of us have a level of resilience. But when we're in a state of burnout, it's difficult just to bounce back. It's difficult just to get up. And our resiliency levels can be low. When I'm measuring someone's resilience, we look at it on a scale like from 1 to 10, with 10 being the highest, and where they're feeling of them really getting up and getting back to where they were, or to a state where they can begin to function at a level again. Next slide. So the old definition of resilience is bouncing back, getting up to the old status quo. But we now know something different, that's not healthy. Because if we did get to a place of burnout, there was something in what we were doing. There was something in what we were experiencing. There was something in the way that we were doing the work that we were doing, or there was some way that we were not taking care of ourselves in the correct manner that caused us to get to a state of burnout. So we just don't want to bounce back and get up and go back to the way things were. But we want to get up and do something different. Next slide. So the new definition of resilience is the ability to positively respond to adversity. So what does that mean? That means to look at, how did I get there? Okay, not just getting up, okay, I feel better, I'm there, but how did I get to that place of burnout? And how do I avoid getting there again? What do I need to do to take care of myself in a positive manner so that I can avoid it? And so what I find is that some people go in these cycles where they'll get burned out, they'll get themselves picked back up, and then they'll get burned out again. And over time, you get to a place where that causes a lot of damage, mentally, physically, emotionally, spiritually. And what is a healthy way to do it is to say, okay, I'm going to slow down and assess myself and spend some time and figure out, how did I get to that state of burnout? And how do I not get there again? Next slide. So you have the power. We can't control what happens to us, but we can control how we respond to it. So sometimes we cannot control that we got to this state where we were feeling like things were overwhelming. But once we do know, once we have the insight, I often tell people, when we're ignorant about it, we're ignorant, we don't know. But once we gain a level of insight and we have knowledge, then we can control it and we can respond to it differently. Next slide. So let's talk about bouncing back in a healthy way, because that's the goal. So it's not, again, like I said, just getting up. It's not fake it till you make it. It's not just keep going. It's not just things will pass, life goes on, we're strong, but it's about really assessing where I am and what is my resiliency plan so that I no longer get back there again. Next slide. So reducing it and building resilience, it's like building a muscle. It's like, okay, I talk to people often about, it's like if you're weight training, how do you build yourself so that your capacity grows, that you can build more muscle mass? So if we don't take care of ourselves when we need it, we cannot give out to others and the best possible care when they need it. And so in order to do that, we have to build our resiliency muscle mass. And so that's identifying on the 4 spheres that I'm about to talk about, how we can build these. Some of you have heard this before because I'm currently working with Euclid Hospital, and we're working on some of these and learning how to build these for ourselves. Next slide. So there's mental resilience, there's emotional resilience, social resilience, and physical resilience. And those are the 4 different types that I'll talk to you about real briefly on how to build. Next slide. So the mental resilience is all about positive thinking. And I talked to you about that in the beginning, controlling your thoughts, your actions, your belief. If when you find yourself getting into this place where your thoughts are leading to negative, that lets you know, okay, I'm going down in that spiral. You want to foster optimism. You want to speak the truth, what is the truth, and what has been the truth about yourself. And you want to avoid awfulizing, This places you mentally in the dark side. And so whatever you can do to not do that and to keep your mind positive and foster those positive beliefs about yourself and your situation and what you can do, you can avoid burnout mentally. Next slide. The next piece is emotional resilience. So you sit with yourself and learn to sit with things like discomfort, your feelings, your nervousness, you're mad, you're sad. Like Dr. Stamper talked about, your anxiety, coping with it, avoiding medicating your emotions, and work on being cognitively flexible, finding more ways to solve an issue rather than boxing yourself into one way. And facing your fears, hiding from your fears makes it worse. Face it, things like your anxiety, things that seem like they're gonna overtake you. And have a moral compass, a strong feeling of right and wrong, telling yourself what we must and when we feel we can't. And so when we have these strong feelings about life, and when we have this, we're able to really dig into emotionally what's going on with us. And so we just want to avoid emotionally healthy habits and being aware of where our emotions are. Am I sad? Am I glad? Am I upset? Am I feeling anxious? Am I fearful? And being able to sit with that and speak it out and work through whatever it is. Next slide. And then the social resilience, being very careful of who you let into your space. You want to engage in people who are going to feed you in positive relationships. People you interact with versus the negative people. You want the positive people around you. You want people that are not going to drain you. And the one thing that I talk about is avoiding things like social media, the news, and those things that can really bring you down and that awfulize and sensationalize things that are just so awful and overwhelming. And so I encourage people to do things like take a planned hiatus from media, turn off your phones, turn off your email, and really spend time with connecting with nature. I was just reading an article today about individuals who spend at least an hour a day in nature, have higher levels of resilience, and they can truly reduce their feelings of anxiety and depression. And so there's something really to that, getting away from this metaverse world. Next slide. And then lastly, just talking about our number one trigger to an increase in stress today is our lack of being in the moment. And that's where our spirituality comes in, our spiritual resilience, building that. We have trouble with being in the moment because we're already on to the next thing. We're on our phones, we're on our emails. Many of you right now while I'm talking, we're multitasking, we're looking at what to do next. We're making our lists, we're checking our emails, rather than being in a moment and saying, what do I need to take in for this next 40, 50 minutes of this time that I've gotten on here? And how can I really do something for myself? And that's how we do things spiritually to really connect with ourselves and center ourselves. Next slide. And so again, being spiritual resilience could be attending to our breathing and relaxing, exercising, just doing movement with our bodies and being aware of our body's sensations, attending to and caring for our body and nutrition, meditation and prayer, self-expression, art, dance, and caring, nurturing self-talk, giving yourself that positive feedback and giving yourself the kudos for all the hard work and all that you're taking care of in multitasking. Next slide. So just remember, you are most important. Increasing your own well-being through self-care really matters. And taking care of your own emotions, your physical, your mind, and your spiritual care is all connected. And that's how you reduce burnout. And that's how you build resilience. Next slide. So life throws challenges, but with patience and resilience, you can convert every challenge into a new opportunity to grow. And I want to encourage you to do that today. My last slide just gives information. You can always feel free to reach out to us. Our URL code is there. You can feel free to use your phone and reach out to us. Thank you.
Thank you so much, Dr. Moore. Great talk, Dr. Stamper. And next we have Rick Oliver, who will be talking about accessing community resources. Rick?
Yes, good evening, everyone. Thanks for inviting me to this panel. I think Dr. Stamper and Dr. Moore did a great job of talking about the mental health challenges we're all facing. And what I'm here to talk about is a program that has been existent in the county for some time that I think can be helpful. Again, my name is Rick Oliver. I'm the Director of Crisis Services at Frontline Service. And for the last 25, 26 years, we have received funding from the county, from Cuyahoga County, to operate a crisis hotline and some services that surround that. And I think, so my job tonight is to really describe that service and how it might be helpful to anyone who might be having some struggles with mental health. On the next slide. So our crisis continuum, there's really three main programs of our crisis continuum. The first is the mobile crisis team, which we'll talk about, and that includes both an adult crisis team and a child response team. They work together. It's a 24/7 crisis program that people call in. We do a lot of work over the phone, but we can go out and see people at times, and I'll talk a little bit more about that in a minute. The second program that I just want to mention is we are working with Cleveland Police to pilot a police mental health co-responder program. It's in the second year. We have one team in each of the 5 districts in Cleveland, and it pairs one of our mental health crisis workers with a Cleveland police officer, and they have the ability to respond to situations that are primarily behavioral health in nature. They do some follow-up work the next day to go out and check on people. So it's a different response. We're trying to get a little bit less law enforcement and a little bit more behavioral health response to people who are in a behavioral health crisis, both mental health and or substance abuse. So we're excited about that program and how it's starting. We're hoping to grow that a little bit more in the future, and maybe even take it countywide at some point. And our last crisis program is our Crisis Stabilization Unit, which is a 15-bed facility that it's an unlocked, it's kind of like a little bit of a step down from a hospital. It provides a lot of the same services. People come and stay there. The average length of stay is between 5 and 7 days, and you get that support that you need, programming, counseling, individual and group counseling. So it's similar to a hospital, but it's a little bit not quite as intense, and it's something that we're able to refer people to if that's something that people need. But I'm mostly going to talk about the mobile crisis team because that's the first step into our crisis continuum. On the next slide. So I kind of describe it in 3 parts. There is this 24/7 crisis hotline where people can, as I said, call in and talk to a professional clinician who's trained to talk to people on the phone. And then we have this adult crisis response team and this child response team. And those, we send licensed clinicians out into the community to see people, those who meet certain criteria, and I'll talk about that in just a minute. On the next slide, so just to talk a little bit more about the crisis hotline, as I said, about 80% of our calls are handled over the phone, and most people who call, and I kind of gave you the breakdown last year of what types of calls would people call about. We do deal a lot with suicide. We do bill our crisis hotline as suicide prevention hotline. We also take calls from the National Suicide Prevention Lifeline that come from this area. We'll ring into our crisis hotline as well. So we do feel like we specialize in suicide prevention, helping people who are having suicidal thoughts. And so we, as we talk to people every day who are having suicidal thoughts, and many people can be treated at home with suicidal thoughts. I think it's actually a little bit more prevalent than some people think it is. But we are interested in talking to people who are having those thoughts to kind of give an assessment of where they're at and what the resources they have and how best we can help them, because it's not comfortable to have those thoughts of suicide. So the idea is to kind of put interventions in place that will reduce those kind of thoughts. Depression, interpersonal conflict, people who have psychosis, hearing voices, having delusional thoughts, and anxiety. So Dr. Stamper and Dr. Moore talked about some of these issues. They're very common on our crisis hotline for people to call in with these issues. And some people really just want to talk about them. Some people want to talk and kind of get an understanding of how normal these symptoms are and what they should do about it. We are not an ongoing provider. Our role is to kind of assess what's happening and get you connected to the best service that's going to help. On the next slide. So when people meet certain criteria, their symptoms are a little bit more severe. What we prefer to do is then see them face to face. We consider our service a same-day crisis service. We do not respond emergently. We don't have enough staff to do that, like to be there within 10, 15 minutes, as some people sometimes need to be. That continues to be a law enforcement type of response. But we can see people same day, and so we can go out into the community to see people. People also come to our office. We're located in the downtown area, down right next to Cleveland State University, and people will come down and meet us down here, or like I said, we can come out to see them in their homes. And what I gave a breakdown here in 2021 after we saw people, and we did about 1,200 face-to-face assessments in 2021, and this is the breakdown of what was the result of those assessments. 27% of the time, the person stayed at home and followed up with, we have psychiatrists at our place that people can see for, again, a short period of time before we connect people to an ongoing provider, clinician. 15% of the time, the person stayed at home and we just connected them directly to another provider. 19% of the time, there wasn't any additional services needed, or the person wasn't ready for the next step in the services. But there are people that get admitted to the hospital. As I said, we do deal with people who are struggling with suicide, and sometimes the safest place for people to be are in an inpatient facility where you can get some services pretty quickly. And then 5% of the time, we put somebody in our crisis stabilization unit. So that's a quick breakdown of what typically happens when we see people. We certainly do not put the majority of people in the hospital. Our goal is to keep people in the community and try and get services to them that are going to be helpful to them. On the next slide is a similar breakdown for our child services. So anybody under the age of 18, we have staff that are specially trained to deal with children and adolescents. And you see the breakdown is pretty similar after we come out to see somebody. Most of the time, people stay at home. Sometimes, there no further services are needed, and you see a smaller percentage go to the hospital, but a little bit larger percentage go to the crisis. There are some crisis stabilization units that we do not operate for children and adolescents, but we refer to them all the time. So those are some of the services that, or some of the outcomes after we come out and see somebody in the community. On the next slide. So one of the big things I didn't do very well of was to post the number for the crisis hotline. So I'm going to repeat it a couple of times because I put the QR code there and I neglected to keep the phone number there. So the number is 216-623-6888. Again, 216-623-6888. If we can put that in the chat and get it out to people, we can do that. That would be helpful. That was a little oversight on my part. So that's thank you. So that is my part of the presentation, and I think we might be moving into some questions and answers.
Thank you so much, Mr. Oliver. I mean, this was great. I think we had some great talks. I would really like to encourage everyone or as many people as feel comfortable to put some questions in the chat. There were some questions submitted through the registration process. So many of them were actually answered by the presentations, but I'm going to go over a couple of them and ask the panelists to chime in and see if they can to answer. I'll start with Dr. Stamper. So how do you get help for a family member or a friend? And what if they refuse?
Yeah, so I think first of all, continuing to encourage them to get help is like the first step. If somebody is in crisis, I've actually had really good luck reaching out to Frontline and saying to them, there is somebody that I am really worried about. Can you help me out in this situation? And they have been great about it. I know I am a clinician, but I imagine, and if that is the case with somebody who is not a clinician, that is also another route. At worst case, you can also call 911 for assistance, and they will be there to help you out too.
Thank you. Does anyone have anything additional? Okay, thank you. Please address stigma surrounding mental health in diverse communities. Dr. Moore?
Yeah, I can speak to that. So in many diverse communities, especially in the African American community, there have been longstanding stigmas. Historically, that it's something we don't talk about, it's taboo, or that we only take it to our church and we pray about it, and that's the way to deal with it. We are slowly seeing the move and transition to being more informed about that. And it's not just in the African American community, it's also in the Latino community. And I see it in my Asian clients as well, because they are closed communities. And oftentimes we did not want to go to caregivers that did not look like us in fear of what would happen if we went and shared what was going on with us. So we now realize, and we're learning and we're educating that it is normal. It is something that we can and should talk about, and that we are partnering with churches and pastors and mosque leaders and so forth, and educating them about, okay, we can have both. We can have, and that both are needed. And so just like I speak about, I spoke about when I talked about your spiritual resilience, we know that spirituality is a large component to who we are in our life, as well as our mental health is a large component, and the two go hand in hand. And so it is changing, but I say not fast enough. I still talk to many minorities that struggle, and many of them only want to see people that look like them, and there's not enough of us to do that. And so I encourage them that there are others that don't look like us that can help us and that care about us and that are just as knowledgeable.
Excellent, thank you. Any other contributions? Okay, thank you. There were some questions related to dementia care and support services. So for dementia care, stroke care, what kind of support services are available there? And speaking of support services, what about the caregivers? Caregivers really go through a lot. They have issues with their own emotional resilience and physical and mental resilience that they have to develop about being a primary caregiver. So let's talk a little bit about support services. Let's see, I'll start with Dr. Stamper, and then maybe Mr. Oliver can contribute as well.
So this one is very minor, but I think is really important. The first place that I usually recommend that patients and families really go to get support about dementia care. If you have a physician that you're working with, please ask them to help with that. They often have social workers that they work with who are able to connect you with resources that will actually work with the insurance that you have. They might know about programs that work with the particular job situation that you have and need help coordinating care around. They might know programs to help you get away and get like a much needed break. So that is, I would say, the first step. Is just ask your provider if they can connect you with a social worker who will know a lot about these resources and can point you to ones that will be most beneficial to you.
Thank you, very helpful. Anything additionally, Mr. Oliver?
Yeah, I would just say, although dementia is not something that we specialize in, we get calls for everything. And we work hard to keep our resources up to date so that if we're not the right facility or the right organization to help, we will work with individuals who are calling to get them connected to what that correct organization or provider is. And so I encourage people to call the Crisis Hotline and see if they can work with to get more information about every situation. We try and gather some information and try and specialize that next step with whatever's happening with that individual.
Thank you very much. And Mr. Oliver, I'm going to stick with you for this next question. There's a question in the chat. How can you help an adult child who we believe is having mental health issues since COVID, was living on the street for a while and blocks contact from us? Last known location is in Columbus. So, I have an adult child who may have some recent mental health issues, who's very disconnected. So first to the person who put that in the chat, our hearts go out to you. I mean, that could be very traumatic for you. And so we're really sorry about that. How can we guide this person?
So the first thing I'll say is that about 35 to 40% of the calls we get on the crisis hotline is someone, a family friend, calling about somebody else. That is a very prevalent thing that people are calling, and many times it's because the individual they're calling about doesn't necessarily want help or doesn't need help. And so our role in that is to give the individual who's calling support and give them some information that they can use. Now, we will go out to try and see people if they're not, even if they're not willing for services. If we're invited out by a family member, we'll go out and try and engage that person into services. Sometimes it works, sometimes it doesn't work, but we will make that effort to come out. So for someone who is a family person who's disconnected and is on the streets, the first thing that I do, if this was happening in Cleveland, is I would get the name of the person, because we frequently are at places where, like, the homeless shelters here, our staff are frequently there. And so we might, if we're looking for somebody, we might get a call from somebody else about that individual. So we're trying to build information that's going to help us if and when we have contact with that individual, so we can provide, again, the correct intervention, the correct assessment to help that person. So I think calling, and I know Columbus has a pretty good crisis system as well. I think NetCare is the agency that provides that crisis hotline. I would call them and have a conversation with them about the situation and see what resources they may have available to help out.
Okay, thank you. That's very helpful. And so, best wishes to you and your family member. There's another good question. I'll direct this to Dr. Stamper. Can you talk about the difference between depression and seasonal affective disorder?
Sure. I think there's a lot of overlap between depression and seasonal affective disorder. But one of the things that you will notice about seasonal affective disorder is it's kind of what it sounds. It's what it sounds like. You notice that those symptoms of just feeling kind of down and depressed really go along with, the winter. That's when things are the worst. And you might notice that as the sunlight comes out more, you start to feel a lot better. And so I want to put a plug out there for, they have, I call them happy lamps, right? They have these lamps that I think are so useful, especially here, since we get a little less sunlight in the winter time. If you're able to hop online and order, you could look for, it's also called sad lamp. Just finding one of those lamps. I believe it's 10,000 lux is the type of the watts, or I forget what it's called, but that you're looking for. If you can find something like that, just sitting next to it first thing in the morning for, even 10 minutes out of your day, drink your morning coffee next to it, can help people so much. Yeah, that seasonal affective, really, you'll notice it going along with the seasons versus maybe depression, can happen anytime. And it might actually be made worse by the season. So it's not like you can't have the seasons affecting that depression that is already there.
Thank you very much. Anything to add, Dr. Moore?
No, I think she summed it up very well.
Okay.
Thank you.
So I'm going to direct this next question to you, Dr. Moore. Are there any specialists in trauma? And what about abusive situations? Some of your talks did address these issues, but people are really looking for, are there any specialists and any providers and resources for trauma?
Great question. Yes, there absolutely is. Many of us and myself, we are trained in EMDR, which is eye movement desensitization reprocessing, which has really been found to be a great therapeutic technique to be able to assist people with reprocessing trauma and really shifting the way that they respond to trauma that has happened. Dr. Stamper talked about trauma, and trauma is one of those things that if we do not directly work on it, then it will continue to show up and manifest in other ways. And so all of us have said, especially now what's happened with the pandemic, all of us have really experienced some forms of trauma, and some of us, trauma's like on the spectrum. So there are some people who are on the spectrum of mild, moderate, and severe levels of trauma. There's compound levels of trauma. There's multiple levels of trauma that people have been through. And I say, if you are seeking help for trauma, you want to try to get someone that specializes in it, someone who can provide trauma-informed therapy. That is really directed toward really helping individuals with mitigating the effects that they've had as a result of a traumatic experience. And if you can get someone that is trained in EMDR, it is life-saving. I will say for myself, many years ago, about 2 years ago, I went through EMDR myself because I had had a traumatic experience on an airplane. And I do so much traveling, and I found myself having such anxiety when I was getting on an airplane to go speak. And to the point where I was even thinking about, well, how can I drive? How can I get a train there? And finally, I was like, okay, this is just crippling me. And so someone said to me, you should try EMDR. So I said, okay, I will try it. I tried it in 2 sessions. And this doesn't happen for everyone. In 2 sessions, it completely changed for me. And so then I decided, oh, I need to go get trained in this because people need this. And so I went and got trained in it, and now I provide it for clients who have severe trauma and compound trauma, and it really does work. So you want to find someone that specializes in it and that provides it. You can always use Psychology Today, and you can find individuals on there, and we list on there what we specialize and what we provide, and you can find experts. That's Psychology Today. You can just Google it, and they are practitioners all over the country that provide services.
Okay, thank you. Thank you very much. So you were coming up on time, but there is a subject that I'm sure will garner lots of discussion between all of the panelists, and that is drug addiction and substance use disorder. And everyone alluded to it either in the crisis situation or as a manifestation of people trying to, or not the greatest ways of dealing with it, anxiety and depression using substances. But what about drug addiction services related to it? And someone submitted a question about craft or community reinforcement and family training. So I'll have anyone pipe in to speak to this, but I'd love to hear from all of our panelists.
So I can start. There are many substance use disorder treatment centers. The research has come out since 2020 that the increase in overdose deaths, as well as the increase in individuals being diagnosed with the substance use disorder, has increased as a result of the effects of the trauma that we all experience around COVID. And so there are many treatment centers. My agency is an outpatient treatment center for substance use disorder, and there are many more that you can actually look on our Adams Board website that are partner with the Adams Board that provides the services. It starts with the first step of getting an assessment and then determining the need from there and the direct level of care. There is insurance, and if a person does not have insurance, especially in Cuyahoga County, we have great resources through our Adams Board in order to get people indigent care that needs indigent care. And for the family members as well, you want an agency that treats the entire family, because we know that substance use disorder is a system disease and it affects the entire system. And so it's important that the entire system receives the help that it needs. So I'll stop there and let my other two colleagues speak.
Dr. Stamper or Mr. Oliver?
I'll just add in that, we do get a fair number of calls for people calling about themselves. And again, we keep up on our resources and get people to whatever level of service that they need. We also do get a fair number of calls from family members who are frustrated because their significant other is not willing or not ready to get help. And we spend a lot of time in support of that individual who's calling, because it's a very valid situation, a problem. It is as Dr. Moore said, it's a family issue, and it affects everybody in the family, even if only one person has that diagnosed issue. But everybody else in the family needs support, and we'll provide whatever support we can in those situations.
Thank you. Dr. Stamper, any last words on that topic?
Yeah, you guys, Dr. Moore and Mr. Oliver have given outstanding responses to this. And I also just want to give hope. That's something that I think is really important with this, is that, there are, like has been mentioned, there are a lot of treatment options as far as getting help for substance use disorders, both for the individual and for the family. And just continuing not to give up. I know that yeah, I think that is kind of the only thing that felt like it hadn't been said yet. But talk to all of your resources. I always start with my primary care doctor when I'm not sure what to do, and they can help you out. I at Cleveland Clinic am there and able to help out. I know we have substance use treatment there too, and there are just so many places that once you kind of step into the door, are willing to help you out and meet you where you're at. That's what you want, is a place that's going to meet you where you're at.
Thank you very much. There is one other question, and that is about cost factors. How do you access care if cost is a consideration? Dr. Stamper or Mr. Oliver?
Well, I'll just start by saying that our services are free of charge. Now, we don't provide any ongoing services. Our role is to really assess what's going on and provide some brief intervention, and then link to an ongoing provider. But there is no charge for, even if you have insurance, there's no charge, there's no, deductible, there's no out-of-pocket cost for our service is fully funded by the county. So there would be no cost for our services. And when someone calls in, that is part of the process of understanding what resources somebody has. Do they have insurance? Do they have Medicaid? Do they have any type of benefits that will help? And then we'll help them using that information, link them to a provider that makes sense for them.
Okay.
And I would just add on to that many agencies have resources. Many of us have grants and indigent funding. So there's always a way, even if it's not with the agency that you go to, that we can refer you to an agency that can provide it at no cost. And like I said, our Adams Board has money where they fund many of the agencies and assist with that indigent funding. So I've never had a client where I could not get them somewhere or provide the services ourselves for them.
Thank you. And Dr. Stamper?
I actually don't have anything to add to that. Those are really great places to look. Yeah.
Absolutely. So we are coming up on time, and in the last minute, I'd like to say I truly hope that this session was beneficial and helpful to everyone. I hope that it was interesting to everyone and that we were able to answer your questions. As a follow-up, that we will supply a mental health resource guide to all of the participants for easy access for local community resources. And there will also be some online mindfulness and meditation websites for your personal use. At the end of this forum, you will receive a post-event survey. Please complete it and return it as soon as possible. If you have any questions or concerns that have not been addressed here, you can email us at chp@ccf.org. Again, thank you all for your engagement, participation, and partnership. Thank you so much, panelists, for your participation and your time commitment to this. And I hope everyone enjoys their evening. Take care. Bye-bye.